will include the core and shell, which is basically the structure and the veneer of it, and then we'll have the finish out of the building itself, and you can see those target dates that we are looking at achieving those permits. So we are under construction.
Again, some interior renderings, concept renderings for the medical outpatient building. The top left is the entrance into the ambulatory surgery center from the elevator lobby. So that's what the view as you come into from the garage into the ambulatory surgery area. Center bottom is a nurse station again, or no, I'm sorry, that's a prep recovery unit within surgery. And then the top right is a typical nurse station within the clinic's space on the upper floors.
Our central utility plant, as you've seen, Morphe Garage is gone. It is 100% gone now. They're actually grading that area, getting ready for the actual foundation. We have submitted our foundation permit this month, and we're in the process of finalizing it in order to start our foundation construction next month. Again, just like the MOB, we'll have the next permit will be for the core and shell, and then we'll have a finish out. Very little finish out to this one, considering its majority of its equipment.
Yeah. Obviously, because it's near and dear to my heart, I like to refer to this as the heart and lungs of the hospital. All utilities that support patient care areas come from this building. These are just some concept renderings of the boilers, chillers, piping connectivity. Electricity will come from Encore through generators. All the redundancy that we require for the hospital for both regulatory and patient safety are centered in this building. So comes through this building, gets connected, and feeds back to the hospital.
We've got our new hospital. We are completing our design development stage right now. The next step in our design phase will be the construction documents. So we're not quite ready for a foundation permit yet, like the other two projects, but we're getting close to it. Right now, we're just finalizing our exterior package. You know exactly what is that skin going to look like? What is the panelization going to look like? How is it coming together? We're also working with the city right now on finalizing our traffic impact analysis. You know, we're going to have some more traffic. It's going to be diverted a little bit differently. We're working with them on where we have traffic signals versus where we have four-way stops, so that we can keep a good, even flow around the campus, but also in and out of the hospital itself.
So this is a set of renderings of the landscaping around the entrance to the new hospital. These are concept drawings. These plant selections obviously are driven around several factors. Near South Side, they're native plants. We want low maintenance plants, and they're also around security concerns. We want nothing too high or big heavy bushes for folks to hide behind. So just some early options around that front door entry. Some options around patient rooms. Top left is a typical ICU. Bottom left is a typical patient room. And then top right, labor and delivery, and bottom right, NICU.
And we'll end it with our kind of campus rendering, if you will. Yes, sir.
Hospital. So is the hallway outside? Is there a hallway in the back also as well?
In the back of the hospital itself?
Oh. In the middle of the, because we went to a few hospitals many years ago, and they have what they call on stage and off stage.
Oh yes.
Yes.
Do you have that kind of walkway so that it will be less threatening when we walk image through the hallway?
Yes, we do have that.
Yeah, and there are different elevators that the service and support staff will use versus patient public to bring goods up and down to support those nursing units as well. So we have segregated that traffic as much as we can.
Yes.
So we are now looking at cash flows on a quarter. Oh, go ahead.
Can you give us again the completion day of each of those projects? Because that went off the screen so fast. Because it looks like a couple are going to open up this year, 26?
So yes, the Health Center for Women will open up at the end of this year in 26. The central utility plant will be opening up in 29.
With the MOB.
With the MOB will be opening up in 29 as well, and the hospital is 2030.
Okay.
So the dates are the same that they've been. But the Health Center for Women does open at the end of this year,
And the garage,
March 16th. So in a few weeks.
just a few words. You spend a lot of money, Dr. Duncan.
Which is a good segue into the cash flow. So, in order to show you really the cash flows that are occurring, we'll be bringing you these cash flows quarterly. And with the anticipate, we work with Ramon on when we expect the expenditures to go out the door. So I'm providing you two graphs, and I'll go over them because they are busy. The one on the left side will be by quarter, and the one on the right side is cumulative. So it'll be adding the quarters together as we progress. What the lines mean on the graphs, or the dotted line, is the prior cash flow projection that we would have shown you. So in this case, this ties to what we showed you in December when we were going over the future fund information. So this would be the last cash flow that we had done, and then now the bars are the new cash flow for this quarter, or the quarter ending 12/31. The bar colors mean green means we've spent the cash, so green for cash. That's gone out the door. The yellow are the projection. So it kind of gives you what we've done, what it is to the last projection. So what you'll see, for example, the first bar is really high because we just did everything prior to fiscal 26. There was no need to actually put that into the projection. So the first little green bar is the first quarter of fiscal 26, which ended in December. That is below the projection. That does not mean the project is behind schedule. It just means we're not having to pay them as fast, right, Ramon? So we appreciate that. All right. So, we are looking at that. We look at it monthly. We reproject quarterly though on where the spends are going. And so not much variation, except for we were a little under for this quarter. We're learning as we go. And so hopefully this will give you a good picture of where we thought we were last quarter and where we expect to be this quarter and what we've spent. Any questions? All right. So on the next page, you'll just see a summary of the projects. You've seen the schedule in the past. This is as of January, not December, as the prior graph was. So the budget at just under 2.5 billion. The green columns, the payments, are the cash out the door. The committed is everything we've signed that we haven't had cash out the door on. And then there's the total of those two columns. So they go all together. So we've spent about 735 million, or committed, to 735 million, of which 273 has been paid out. And then the remaining budget is 1.7 billion at this point in time. Just to give you an idea. Any questions?
Well, I have a question on it, Brian.
You.
What start construction on the garage?
Well, that's a good question.
Let me see, hold on.
Say,
Started on April 24th of
24.
2024.
24.
Mhm.
Time frame.
2 years.
Yep.
Thank you.
Okay, next we'll have a CFO update to consider approval for the January 2026 unaudited financial report by Kim.
All right. So we're gonna, just a couple comments before we get into the financials. First, I did send out an email to the group, but we did get our debt ratings upgraded, not upgraded, but updated for this year with KBRA and Fitch. So they both held our ratings. So KBRA is a AAA stable, Fitch is a AA stable, so it's good. We will be seeing our S&P in a couple weeks. We're doing surveillance meetings. And what surveillance means is they just want to make sure that they understand what's going on in our organization. We'll be doing those next Friday with the agencies. And so things are looking good. We've gotten positive feedback from the conversations moving forward. So just wanted to update the committee that that's great work. on the district's part. The second thing I wanted to go over before we do the financials, I can get to this, on your tables. There we go, whoops. I also gave you a paper copy of the budget calendar for this year, and this centers around what our approval processes for the year. So we're aiming to have the budgets, did you provide handouts for these, Suzanne? No, okay, we can look at it on, oh, she's got them, okay. We are expecting to complete the budget by the end of May to have it in a position to really begin conversations around what our budget looks like. We do have, I call it opening day this Friday, when leadership starts working on their budget. We've been working on volumes, working on all the efforts around putting together the assumptions for the budget. This calendar then starts in May with the Board of Managers having a budget and strategy retreat. Last year, you may recall, we did it in August. We'll be doing it in May this year. It will be on the 5/14, which is the scheduled Board of Managers meeting day. We will be doing, we'll bring Mike Spivey back. We'll talk about the assumptions for the budget and really look at how we're moving forward and put the budget together. In June, the Finance Committee will have a budget review meeting. At that meeting, after that meeting, we would potentially have Board of Manager question meetings, as I had done last year, where I had a few of you in a session and we would talk about your questions about the budget. And then in July and August, it's a little busy. We'll have Finance Committee at the end of July for draft approval of the budget. I'm going to go down to the Board of Managers draft approval at the middle of August, and then we would do a joint board meeting at the end of August on the 27th to do final approval of the budget. In between all of that, we have changed this year, and we'll be doing our presentation to the commission on August 14th of our budget. That will be a Friday. That will be day after the board meeting. Prior to that, the materials are due to the county by the 3rd of August. Working with the county, they suggest that the 5th and 6th of August was when we potentially could have meetings with the commissioners and the judge. And then we will have to post on the 7th with the hearing or the budget presentation on the 14th of August. The September, the court plans to set the tax ceiling on 9/1 and set the final rate on 9/15. If we need to come back together to have a revised budget, we would then do that at the end of September. So I just wanted to make sure you had this in your hands so you kind of knew what the cadence was. We really want your input. We really value the board's support as we move forward with this. So any questions from the group?
Not just the date was wrong. 8/13/25, so it should be 26.
Oh, good catch.
Yeah, we're going back to the future.
We will adjust that. All right.
I guess my concern is is that we're going to the county the 27th. Then the county sets the tax on the 1st.
So we're presenting to the court on the 14th of August. These are a little misaligned. I apologize for that. On the 14th of August, then we'll bring it back to the board at the end of August for approval. We will be working with the commission. We will be then asking you, of course, to be working with your commissioners on where we think the budget is. And then the court will set the ceiling and the tax rate in September, as they have done in the past.
Yeah. I mean, just the problem is we approve something that we don't know it's approved. Now, what we work it out where we get, if we get it on the 14th, I'll make sure everything's done right because that's my birthday. Okay. So we could conceivably come back, even need to say this, with some amended budget if the court That's the rate again.
Much like we've done the last, I believe,
Yes.
couple years, yes.
Yep, the same as we did last year.
Gotta make sure everybody vote.
Even when they set the tax ceiling, they still can, that's the maximum, and then they can revise that down also as well, just like this year.
Is there anything else?
Anything else on this section? I'll move on to the financials. Maybe. All right. Let's move past this. Maybe. There we go. All right. On this slide, you have the financials for the month of January as year-to-date, month-to-date. We actually have started out the first 4 months of the year in a solid position for the year. We do have some headwinds coming our way. I know we talk about that a little bit. We have the ACA with the premium tax credits not being extended. Individuals, Texas had a higher enrollment in the ACA. However, individuals have up to 90 days to actually pay or cancel their premiums into the year. Plus, they'll defer care if they didn't sign up for the plan. So we don't expect to see impact from the ACA until probably 4, 5, 6 months into the year. And so we do know that that will be impact. Those patients are not eligible for Medicaid. They would then end up become self-pay patients and potentially connection patients for us. So that can have a negative impact, estimating that impact anywhere from $8 to $16 million, depending on the population. The other thing we have going on, which is budgeted in the project, I want to be clear about that, but as we evaluate the project, there are some things that are expense versus capitalized. Soil contamination removal is an expense, and so we have about $9 million of expense that's going to hit the latter part of this year. I'm accruing it by month, so it's about $1 million a month, so it's not going to be a big blip, but it is $9 million. So if you take the $65 million net income year-to-date that we have, please don't multiply it by 3 and assume that's where we're going to be at the end of the year, because we have the ACA headwinds. We do have the living wage or the minimum wage increase coming up. We have the soil contamination coming in. We're also seeing benefits a little bit higher than we had anticipated in the budget. So just cautionary tale, our goal is to always exceed budget to fund more for the community that we're serving. But I want to make sure that everyone understands what's happening the first 4 months of the year versus the second 8 months of the year. So as we look at this and we look and I have changed to look at net income. I think it's easier for you as a board to look at net income bottom line. So we're not wondering, is ad valorem in, is it not in, is operating income, how are we calculating? I think this is a pure picture for the board. So I've changed this graph to be net income. The red line is budget, the green bar is prior year, and the blue is current year, and these are year-to-date bars. January of last year, I will have to tell you, in the first 4 months of the year, you can see December and January spiked up a little bit. Last year was due to supplemental payments that we got that were related to prior years, and that was going on. We are above target for the first 4 months of the year, and we'll continue to monitor performance moving forward. You might ask, so the reconciliation now that I do against net income, we did have, and this is month-to-date and year-to-date columns, we did have the January storm. And the January storm hit, it kept our employees from coming in. They were troopers. I think this organization has done the best I've ever seen in my career around emergency management and taking care of the community. But that impacted volumes. We have made efforts. How do we get the volumes back? How do we make sure the patients are taken care of? But that didn't all happen in January. And so we will see the volume impact as a negative impact for the month, and that you see. The rate impact is up, though. We saw some benefit coming forward in some of our efforts around revenue cycle. We're seeing an improvement in cash collections, which then translates to an increase in where we're estimating our collections moving forward. So we're seeing some benefit there. From the supplementals, we had HARP. That was, it was just timing of the payment. That's that $600,000 for the month. and then retail pharmacy and the patient assistance program, they were negative for the month, primarily because the retail pharmacy patients couldn't pick up their prescriptions at the end of the month due to the storm, and we don't recognize that revenue until they pick it up. The other things hitting for the year, you'll see wages and benefits are favorable. We are seeing great impacts from our workforce optimization. Year to date, we are down 76 FTEs in total, but really quite a few more when you look at the optimization work that we're doing. And that's actually right-sizing the business. This isn't about cutting jobs. This is about right-sizing the business, putting people in the right roles. And we've had some great successes in the departments, and they're very much embracing it. Supplies and pharmaceuticals, you'll see favorable primarily due to the retail pharmacy reduction in volume due to the storm. And then you have provider services. The net revenue was down on the physician side as we're looking at the mix of services and how they recognize those. Investment performance, we all have portfolios. Again, we're mostly in commercial paper, short term. Those did take a little bit of a dive in January. But we're seeing it starting to come back again as we're looking at how we invest in those short-term investments. So really overall, we're about 10 million from net income, no one-times, no prior year stuff hit in the month. This month's about 10 million. And then year to date, we're about 54 million before we add in the one-time about 12 million that impacted us for the month. Any questions? I'm hoping this gives you a high level view of what the major drivers are of our performance each month and year to date.
Again, these numbers are variations from budget.
Correct. You start with the budget at the top, and then here are all the variances, and it gets you to the actual performance in the bottom. Okay. All right, we'll quickly go through the performance ratios that we have here. Operating margin is on, net margin is on the top. We've talked about that. We have operating margin is positive with the ad valorem included. Again, a little bit more favorable than budget when the ad valorem is out, big negative, but it's a little bit more favorable. You're seeing the labor expense ratio, which is one of our strategic ratios that is favorable, a little bit higher than the year to date for the month because of the storm. We had a little bit more labor in the organization to support the efforts that we had. Overtime, contract labor as a percent in very good shape. And then the FTEs I had mentioned, when you look year to date, we're about 76 below budget. And even the FTEs per adjusted patient day is below target. So really doing well there. The unrestricted cash, which is the balance sheet, I will let you know we did make the $107 million future fund transfer in January. So that got transferred over. We will continue to monitor that on a monthly basis. The days cash on hand for the operating is at 193 days. Our target's 180. We were below 180 for the last few months, again, waiting for the ad valorem revenue to come in early January. So we are back above target on policy. We continue to evaluate the cash flow. So it's not just the bottom line, it's what we're spending in capital and any debt payments we have, primarily driving, how much can I move over to the future fund each month? And I'm trying to maximize that as we move forward. Right, I might have just talked through all the slides. Volume highlights, again, I'm not gonna talk about the storm anymore. So patient encounters were down a little bit from last year. When we took a look at the budget and what we felt the community was going to need for January, we were a little bit higher than the community need for January. So you'll see some negative variances as you go down for the month. However, we continue to still be a busy organization. I will take you down to the PEC. The PEC continues to exceed target and grow with the new facility. We're seeing less behavioral health in the emergency room as a percent of their total visits. So we're seeing that. And then also with the clinic visits, we're continuing to look at how do we create more access outside in the ambulatory space. Payer mix. It's pretty steady. You might see a down arrow for a 0.1 move. It was pretty steady for the month where we did see, interestingly enough, a reduction in self-pay. That correlated though to mostly an increase in connection, which they both primarily our self-pay, but connection patients could have a copay or that they have along with their program. So it's pretty flat for the month. We'll continue to monitor this. The ACA is sitting in the commercial numbers. We've broken that out to monitor it separately, and we're also monitoring it from the connection perspective. So it's a very important payer mix payer to us. The balance sheet, you saw the cash on the last side of about 930 million of cash, and then the board restricted assets are now at 1.3 billion after the transfer in January, and then we have bond proceeds still about 240 million. We will be meeting the requirement for the spend by March 31st. We had a requirement to spend a certain amount by March 31st of this year and then March 31st of 2028. We will be meeting the requirement for March 31st of this year, and easily with the CUP and the hospital coming on board, meet 2 years from now requirement, because it's only on this 230 that we have to get there. So, and then lastly, here's the balance sheet size. We've talked about days cash on hand. I do want to talk about days in AR. Days in AR I had mentioned before will go up for a while because we are holding claims longer. We are actually working the denials. And so when you do that, you hold them longer in accounts receivable. So it will go up. This is still a good number. Anything below the low 50s is still a good number. But I will have to tell you, it's what's under this number that's important. And so as we look at the initial denial rate and as we move forward with how we're doing our work. So we've seen, we're trending about a $9 million improvement based on looking at how we bill for emergency services on an annual basis. So that's sitting in the numbers. We've increased our cash collections that we're seeing from the payers. And we continue to move down a road of being more efficient in collecting what's due to us. So I have to say the Rev Cycle group is doing some excellent work. All right. The last page are the financial goals. There are 12 financial goals. Of those, 4 of them are not quite meeting the annual target, but again, we're 4 months into the year. They're close. Total FTEs per adjusted patient day were slightly up year to date. But those are trending in the right direction with the work optimization work. We have the net days in AR. We talked about the length of stay, continuing to look at how we bring the length of stay down in the organization. We have some patients, it's just hard to place them in the community, and what are our options? And then the JPS connection membership's a little flat right now, but again, this is the annual target of 59,000. This is not the 4-month target. So we expect that to continue to grow as we move through the fiscal year. All right. Any questions that I can answer? I think we need approval.
Okay, I'm going to open up our motion to approve.
Actually, I have a quick question.
Okay.
On the
Yep.
Medicare percentage.
Mhm.
They stay very stable. Is that because of Medicare Advantage that keep them here?
Our Medicare Advantage and traditional are staying pretty much the same, unlike what you're seeing across the country. So it's a pretty similar mix. If that's is that what you're asking, DT?
I was wondering if we should put a budget next year for enrollment, for education, in order to get more enrollment. Do the AEP, I think.
Sorry, I'm taking a note, DT. I'm taking a note.
Just for budgeting.
Yeah, and we're in the process too of the roadmap for managed care that we had discussed last year about what our next steps are around moving forward.
Move approval.
Second.
Okay. Thank you.
We have to vote.
Been approved? All in favor?
Aye.
Thank you, Kim.
I'm just gonna stay for the next one.
You're gonna stay for the next one. You know, while she was preparing for that, I thought that Jill and Brian and Ramon was gonna share a little bit more about the outreaches that they've done. They've been doing an extremely great job with our local and small businesses, getting people interested in these projects, this 2.5 billion that we have going on, are getting ready to kick off. So I think that they deserve some recognition during this meeting for doing a really exceptional job with making sure that they're putting JPS out there and that we're open for business. As Dr. Duncan would say, that's something to get loud about.
Thank you.
Okay, so we're gonna move on to consider the approval of increased spend authorization for the document management service agreement between Tarrant County Hospital District and Iron Mountain Information Management.
Yes. So Iron Mountain is our vendor for records retention and storage as well as shredding. We did go out for RFP and had board approval on this contract in 2020. We did an evaluation of the spend for this agreement, and those of you familiar with these agreements, it's not just a fixed amount, it's a very big cafeteria amount. And so in the evaluation of the spend, we need to increase the spend to 1.968 million for the remainder of the agreement.
I have a question on that. On the information that you put in the order for us to review, it was from 2016. They didn't show it updated, you did a new bid. All the information there looked like from the previous bid. Did we update the wrong one?
We can't answer that. I do know in 2020, we did an RFP.
Yeah.
And we did award it to Iron Mountain.
Yeah.
So
Did you do a rebid out?
for this one, in 2020, the contract was constructed as a 5-year with 2 1-year renewals.
So it's not.
We're still in it. They didn't do the normal 3-1-1 that you're used to seeing. This is 5-1-1.
Now, that was.
Make more sense.
It was there and I thought, okay, but I understand. Okay.
Good question. Good catch.
So is this additional 2 million for another year or 2 years?
This is for the remainder of the agreement, and when the agreement expires, we will be going out for bid again.
So this is for years 6 and 7, basically.
This is for the entire, so when the contract was approved originally by the board, it was only approved for the original 5-year spend. Evaluating the spend that the board approved, it wasn't enough. They understand the cafeteria plan. It's tough to project the utilization. And so evaluating it and knowing that we're doing the renewal right now, we needed to get board approval for the additional spend for the full 7 years of the agreement. So to get us all through the 7-year.
Do you think that the original board authorization is sufficient for 5 years?
The original was not sufficient for 5 years.
Okay. But this not only tops off 5, it gets years 6 and 7.
Correct.
You know what, and you can call it the original amount was?
The original amount was 2.2 million.
Okay, this is almost double.
We spend about $600,000 a year for this service.
And it's not a flat fee, it's based on volume.
Correct.
Any other discussion? Can make a motion?
Move approval.
So,
Okay, thank you, Kim. All opposed?
None opposed.
None opposed, so we'll move. Okay, next we'll have the consider approval of interlocal participation agreement between Tarrant County Hospital District and the local government purchasing cooperative. Mr. Charlie.
Good morning. This is an interlocal agreement, which is why it's here for the board. There's no spend on this. The local government purchasing cooperative is also known as the BUY Board. It's a Texas government cooperative that allows us to pool purchasing power for state and local government entities. Some of the benefits for us is there's certain GPO categories that aren't traditionally on Vizient, so this has a variety of categories that are used as a government facility that we may need to access and may get better pricing than doing a local bid. There's no cost. We do get some rebates back for participation. We don't anticipate a high volume use of this, but it is a good, quick alternative for certain categories if and when we need it.
Any discussion? A motion?
Move approval.
Anybody opposed, unopposed? So motion moved? Okay, it passes, okay, thank you. And we'll move on to the next one for Charlie. Consider approval of one exemption to bid Two, pricing agreement for number 2512422047 between Tarrant County Hospital District and Biosense Webster, Inc.
Yes, this is for the continuation of electrophysiology supplies to diagnose and treat certain heart conditions. It is a proprietary and tied to specific equipment that we have. This is a 2-year pricing agreement. They typically have a 3% increase. We negotiated that to 1.6, so we minimize the cost impact, but it is physician preference and tied to specific equipment that we have.
Any discussion? Move, okay.
Second.
That's it.
Okay, so motion passes.
Thank you.
Thank you. And none opposed. Okay, next we have consider approval of design amendment between Tarrant County Hospital District and Heifer Wegner by Brian.
Good morning. Consideration of a amendment to the design services for the MOB for $3.1 million.
Any discussion on that?
What's the amendment? What is that?
So the amendment is the initial contract is based on conceptual design. And so as we reported earlier, we're moving to construction documents. So the design services are mostly complete, and this trues us up with the services we've received from Hafer Welker. This money is included in the budget.
It's in the budget. It's a weird one. Okay, do I have a second?
Yes.
Second.
Okay. I'm sorry, go ahead.
This actually is primarily with the additional floor we added through board discussion last summer to the MOB. Originally, it was one floor less.
Okay, sorry about that. Okay, so we had a motion, we had a second by Pastor Emerson, first by Dorothy, first and second. Any opposed? If not, the motion passes. Okay, next, consider approval of the IGMP, which is the initial guaranteed maximum price, number 2, between Tarrant County Hospital District and Austin Commercial.
Thank you. This is for IGMP2, which is essentially the core and shell for the hospital. So the initial GMP was for site work and utility connectivity. This builds footings, foundations, exterior steel, exterior skin of the building, and gets us that much closer to what we were sharing earlier.
This is for both towers.
Yes, this is for the entire hospital.
Okay, so we got a motion by Pastor Emerson,
Second.
second by Dorothy. Any opposed? If not, motion passes.
Thank you.
Thank you. Next, we have considered approval of interlocal agreement between Tarrant County Hospital District and the Tarrant County Public Health Department. Joyce,
Yeah, good morning.
good morning.
So this interlocal agreement allows Tarrant County Public Health to refer their patients over for basic imaging services. So it's revenue to the organization for this agreement.
Any discussion? There's a motion?
This for Dr. Bird's area.
So what?
This
Sorry,
for Dr. Bird's area.
I'm sorry, DT.
Is it for Dr. Bird's area?
Yes, yes, public health, yes. Yes, sir.
Been you in a long time.
I know. I try to let Charlie take my contracts forward for me, so,
Maybe we should defer this to the next meeting.
okay. I think I am back next month, yes.
Move approvals.
Second, okay, we got any opposed? If not, motion passes. Another one for Joy?
Yes.
So item 8.
Hmm? Consider approval of MHMR of Tarrant County Professional Service Agreement, inpatient mental health services for voluntary and involuntary commitments between Tarrant County Hospital District and MHMR of Tarrant County.
Thank you. So this agreement allows MHMR to send their patients over for inpatient commitment. And this is a part of our agreement that we've had standing with them. So it allows us to have 17,746 authorized bed days for these patients. It's a one-year term agreement. And this should not say total spend, it's revenue to the organization to JPS.
Okay, can I get a motion?
Move approval.
Second by Pastor Emerson. Any opposed? If none, then motion passes.
Thank you.
Okay, we're going to consider approval of terms of services between Tarrant County Hospital District and SHI Government Solutions. Will Showalter.
Good morning, everybody.
Good morning.
So SHI is the value-added reseller for Logic Monitor, which is the vendor and the tool's name. This is $293,000 per year for a 3-year contract. It was determined that we need to be a replacement. We went out for an RFP and so selected it. The tool itself is an end-to-end infrastructure and application performance monitoring tool. Well, it's a cloud-based, replacing our on-prem tool, and it provides some added security as well as cloud support and scalability features that we needed.
Can you get a motion? Okay, Dorothy, then Pastor Emerson. Any opposed? If not, motion passes. Okay, next, consider approval of exemption to bid and to JPS required terms and conditions between Tarrant County Hospital District and Varian Medical Systems.
All right, this is a contract for $1.4 million over 5 years. Variants are existing radiation therapy application. We're getting 2 things out of this. One is a standard upgrade, providing new features mostly focused on user capabilities in user navigation. But most important, it provides the cloud capability, moving it out of the data center. And if it's so approved, we'll have it out and in the cloud by the end of summer.
Get a motion?
Approval of the exemption and of terms.
Okay, a second? Any opposed? If not, motion passes. Okay, the next one we have, consider approval of addendum to the DIR contract, number DIR CPO 5382 between Tarrant County Hospital District and General Data Tech.
All right, this is a contract with General Data Tech for 3 years for $3.1 million per year. This includes software license and maintenance, as well as wireless beacons, devices, install maintenance. What we're accomplishing here is threefold. First, the modernization, consolidation of our existing real-time location systems, of which we have 5. In the short term, the rollout of hand hygiene, staff to rest, development of patient and infant asset resource tracking capabilities. Long term, this will be our ambient backbone, creating the platform for real-time services.
Okay, motion?
Second.
And second by Pastor Emerson. Any opposed? If not, motion passes. Pastor Emerson, second. Okay, they bring us to reconvene in executive session.
I got one more.
Oh, we have one more? Which, oh, sorry. Consider approval, sorry about that. Consider approval of addendum to DIR contract, DIR CPO 4456 between Tarrant County Hospital District and General Data Tech.
Again, General Data Tech is the value-added reseller. The product is, and vendor is the F5. The load balancers, this is $486K per month for both devices per 3-year contract. This is part of our JPS technology modernization plan. These are the traffic controllers versus the security tools for the organization.
Now can we get a motion?
So, what is DIR stand for?
It's the Texas Department of Information Resources contract, where the state says the state has the contract with the individual and gets the best deal for the folks that have access to DIR. county, state, local governments.
Okay, and again, Texas Department of Information Research.
Yes, sir.
I think that's the only one we have here, right?
Yes.
Okay, again, we had the motion by Dorothy and second by President. Okay, any opposed? If not, motion passes. And now we can reconvene.
Yes, we can, we don't have anything for closed session.
We do not have anything for closed session, so we are done. Thank
That was the fast.
thank you. You said that was fast?
They just get it done. Don't you remember Alan? Were you here for Alan?